Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Ellen Kamhi, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, I am so happy to have as our guest, Nurse Aimee Whalen. Aimee is a registered nurse with over 40 years' experience. She has extensive training and experience in both conventional Western medicine and traditional Eastern medicine. Aimee believes the integration of all of these practices can enhance overall health in body, mind, and spirit. She currently incorporates these practices in the field of hospice care, and she wrote a beautiful new book about hospice care called The Heart of Hospice, which we'll be referring to today. And we have a link to where you can find the book in our post-show archive if you'd like to visit that. So thank you so much for joining us today, Aimee.
Thank you, Ellen. Thank you for having me.
Let's go back in time a little bit and share with us why you became a nurse in the first place.
Well, my dad died when I was first in college, so I was already thinking of being a nurse and not sure exactly, but he died suddenly. And that prompted me to never let anybody die, basically, that suddenly without medical knowledge and having be there with them when they're dying. And I was at a college that I was thinking about biology, phys ed. And after he died, I did transfer to a college that I thought was the best nursing school at the time. There were a few of them, but I transferred from that college to the Catholic University of America in DC, which had a very fine nursing program. And I really decided at that time.
So I became a nurse. Actually, I became a nurse in 1973. So it's been a while ago. And why I got into it really was because I was already an herbalist, already using natural therapeutics and seeing how wonderfully they worked. And I wanted a nursing degree to actually bring natural medicine into mainstream medicine, which I'm still trying to do. That's a struggle. But one of the real conflicts I found, even as a young nurse back then, I could hardly get through nursing school because they had you do interventions and still do to this day, which actually are harmful to people instead of helpful. And that was a real conflict for me. I know young nurses who actually leave nursing and also doctors who are in medical school who leave because of that. But I decided to just kind of suck it up, do whatever they say so I could get my nursing degree. And I'm glad I did. But it is a struggle because you went into it with a concept of wanting to heal. And yet a lot of what goes on in mainstream medicine doesn't necessarily support health and healing.
I was fortunate enough, I graduated in 1981 from Catholic University. I was fortunate enough to be, at that time, Dolores Krieger, who actually came up with the concept of therapeutic touch, and Dora Kuhn's. They were teaching that in nursing school at that time. And I really, out of all the nursing that I learned, when you talk about interventions and care plans and, oh my goodness, what we had to get through to pass nursing, that really resonated with me way back in that school time. And we were able to practice that therapeutic touch on burn patients that we couldn't actually physically touch the patient. And it had a profound effect upon me in nursing school. And I just continued to learn about those modalities that seem to relieve suffering more than the medicine. Sometimes they couldn't do anything for some of the patients. So that spiritual aspect and touch and non-touch was so important to me.
So much so. And I studied with both of those women as well in terms of their therapeutic touch modality, which for our listeners out there, if you've ever heard of Reiki, that's a little bit more well known. It's a lay practice, but it's very similar in terms of bringing universal life force energy through learning specific techniques. And you could see such amazing increase in comfort with the use of that. And it's a specific nursing technique. I love that as well. And thank you for sharing it. Now, by you focusing on hospice, I feel that that is one place in medicine where there is room for, gentle and loving support for comfort.
Absolutely, Ellen. I'm 40 years as a nurse now. The last 10 plus years I've been in hospice. And I said, wow, we can actually do nursing. I'm actually going back to what I set out for. We get to be just present with the patient and the family. And we have a team approach. I'm not alone. I have a whole support system of nurse practitioners, doctors, social workers, home health aides, volunteers, a great staff, everyone who works in hospice. From the first day I went there, I was in awe of what I saw of that holistic team approach. I just really was awed after 30 years in regular medicine.
Well, I agree. And I think it's kind of a shame that hospice is held off until our final hours. Mm-hmm. It seems, because my dad, who passed away last year, and God bless him, he was like healthy, stroke out, right? So his last 3 days was in hospice. And I was just so excited to be a part of that team on the patient side, because just what you said, they actually did turn him. They actually did give comfort interventions, which they've sort of given up with in regular medical beds.
Yes, part of the argument for writing this book is that I really wish to destigmatize the word hospice itself, because patients, if they come on early, there's so much healing that can happen with families. Some are estranged. Some have different points of view on religious backgrounds, the families and the patient. And with our team seamlessly, when we're there, it just sort of flows. The energy, the conversations that happen, it's so hard to have it happen in the last hours. If someone doesn't have hospice, they're still having questions about what happened. Why didn't they know the answers? Why didn't they know about hospice? There's so much information that people are still asking me, is it time yet for my loved one to come on? It's never too early. We make that 6 months or less is the guidelines, but people often come on in the last, like you said, for your family, it's like 3 days, a week. It's not good enough to get it all done in love and just be present.
Well, one thing that really impressed me was the focus on spirituality. They had available, walking through the halls in the hospice, really representatives of every religion. Like we're Jewish. So rabbis came in, but other people came in too and said, would you like to pray? It didn't matter if they had a cross, or some of them were non-dimensional, non-denominational, but it was so supportive.
Yes, I find that our team, whether it's the nurse, the social worker, we have pastoral care that's non-denominational. We call upon everybody's family. And people who are not religious often turn to religion. And some people who are religious decide at the end not to be religious. They have a different spirituality. And it's so fascinating to take people through this. And we as a team just follow their lead, support them where they are. And it's magical, it's beautiful, it's really all encompassing.
And also, the environment was much quieter, of course, because you're not doing all those hectic last-minute IVs and beeping. And, none of that beeping stuff was around, which was so wonderful.
Yeah, we used to call that. I used to work nights in the peds ICU, and we were like, how can people even heal with all the beeping and the lights are on 24/7? And, they finally figured out that that is a problem, and they've, lowered the lights at night and try. But it's not hospice. Hospice is peaceful. It's dignified. It's totally beautiful.
Well, to me, in terms of, my tenant with nursing scholarship, let's say, and studying a lot of the great nurse scholars, including Florence Nightingale,
Yes.
I think hospice is so in tune with original nursing premise of creating peace, creating healing, and sort of getting out of the way. And in this case, although it's focused on end times, I think all of this could be used just for healing.
Yes, certainly.
I mean, beyond, okay, it's an emergency. You're having a heart attack. Hopefully nobody ever is, but, somebody does. Yes, those, you have a car accident. Yes, you need those big and bold and noisy and hectic interventions to survive through that time. But then the rest of the time, there could be so much more of that attitude where there might be aromatherapy, there might be music, the lights are out, nobody's waking you up at 2 a.m. I mean, it's really such a great model.
Yep. And that's a time that nurses can do healing touch, just massage their feet, find out, did anything happen prior to them having a heart attack? Oftentimes, people have had stress at work or their loved one had died suddenly, and then they're getting heart disease. We want to always find out what's behind that. And we can do that in regular medicine, just given the time to be present with the patient and their family to ascertain information.
Yeah, and I do want to really point out your book, because your book called The Heart of Hospice is now available. We had spoken when you were in the middle of writing it, and now it's so beautiful, just absolutely beautiful, because you have wonderful quotes by a palliative care medicine. What does palliative care mean?
So palliative care is, to me, it's almost everybody on every level of anybody in a hospital or sick can be palliative care. But it's recommended for anybody that has a serious illness, and it's non-terminal. So we're still treating the full patient, but I really believe I was on the ground level of palliative care way back in the day when it started. And we said any patient can be on palliative care to relieve symptoms and pain whenever necessary. So it's a beautiful holistic approach, really, palliative care.
Now,
and it can be utilized in hospice care as well. It's just a little different focus, but very much similar.
So what you're saying is palliative care is similar to hospice, but hospice has become synonymous with end of life.
Yeah, so that's the word that I wish to. Angela wrote in my praise. She's a great social worker, and she wrote demystify, and I say demystify and destigmatize, because hospice back in the day had a specific meaning, and the word hospice is a Latin word for actually travelers or young persons traveling and having a place to stay. Like the youth hostels now, it kind of reminded me on a Merriam-Webster definition. It's lodging for travelers, young persons, or the underprivileged, especially when maintaining an illness. And it sort of started in a religious order, but people think that it's a bad word, and it's not a bad word. And they can come on early, and they can come off of hospice if there is a treatment available. It's okay to receive all this support. And then if there's a new trial and their doctor can stay close with them during this process, they can say, I have a new trial. We're so happy to have people come off of hospice. People don't understand that they are really receiving everything when they come on early to hospice.
Right, much more attention. Now, your book is so beautifully written. And you wrote this, I would say, more for anyone, not just for health professionals.
Yes. So I recently was away with a friend of mine, actually out in Santa Fe, and I had her read the book to me. And she was crying, remembering the loss of her sister and her parents that happened many, many years ago. And she said, this book is for everybody, people to remember, people to feel maybe that they were too much in shock to feel back when it happened. And it's for people going through it. I wish it to be for all patients going into hospice, but I wish it was on palliative care's doctors' table so that patients would know about it prior to getting that illness, that end of life diagnosis, so that they're not afraid, so that they can be supported. And I also wish it to be in nursing schools and nurse practitioner schools, and doctors take a rotation in palliative care and hospice. And I just see that this book can show them the compassion side from a family going through this. And for the nurses and social workers, home health aides, volunteers, so that we remember what it's like to be a family. That's why I chose it to be one family going through this process to show how it works if they can come on early.
Well, it's beautifully illustrated. Tell us about how you got these illustrations. It's just, I mean, they're healing in and of themselves.
Thank you so much. Well, the cover is by one artist who I really liked. And then a friend of mine's daughter, I saw, she's a young artist. She lives in Australia, Lucy Ryer. I saw her artwork and it was fun and light, and her illustrations, she's young. She doesn't have the death feeling in her life, thank gosh, but it just brought life to it. So I would explain what I wanted as I was writing the passage, and she would just do it seamlessly. She didn't have any preconceived ideas. She didn't even really read the book. She asked me what I wanted, and she did it better, so light and fun and not scary. To me, I just said, wow, you really are the right person for the illustration. So thank you for pointing that out, Ellen.
And they're very healing in and of themselves. You know, people perhaps don't know, but it's something that is called a yantra, which is an ancient Indian art, where they're actually using form and color, an illustration that you actually do look at, and just the energy from it, the color and the energy essence of it creates biological change in your system. And I feel like your illustrations are like that.
One of the pictures in the book is actually a real photo that a family member took as I'm talking about their walk in spirituality. And I took that photo and I said, I'm going to use this in my book. And they said, by all means. They were so happy and grateful. And I said, it's so important to me to illustrate this. And I gave that photo to Lucy, and she made her illustration from a real photo.
Let me just ask, and this family, like you said, it's their story, although it's replicable in terms of the process with any family. Is this a real family, or is this a composite of your many years of experience?
So in this book, I made a blend. I think they call it a creative nonfiction book. So every story in the book is absolutely true, based on my experiences as a nurse, even going back to when I was a nurse when I was 23. So there are experiences in the book that are all real, and I put them in the book within one family to make it cohesive and readable and more like a novel. And I had help with this because my good friend Patty Alvigi, her dad died suddenly. And when I went to her house and I just said, let me start writing this book, she was hearing my stories, and she said, you have to call my mom right away. My mom's still upset that my dad moved his hand away from her when he was dying. And I said, let me tell you a story. And in the book, I talk about the story about Eric, who taught me how to modulate my touch and just give him a little energy, but not too much energy. And her mom was crying so long after her husband died to have that peace. And that really prompted me and laid out the way the book would be written. So almost used a lot of her family experience and all my stories combined, but they're all absolutely real.
Well, I want to thank you for sharing them in your book. And I want to remind our listeners, you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse. And today, my guest is nurse and author Aimee Whalen, that's Whalen, and we're talking about her absolutely beautiful book, The Heart of Hospice. You know, I think it would be great if there's some way that you could get sort of your book distributed to every single hospice unit,
yes,
to just be laying around there, you know, for people to pick up.
That's one of my goals, is really to have it in all hospices in all countries and have it everywhere so that people can read it and really understand what it means to have an illness, and then have you look at it from a holistic body, mind, spirit perspective, and how we heal even in death, how we heal families, how we heal ourselves.
Well, I hope that it does get wide distribution because everybody could use it. So I would say, you know, your premise in a layered manner would be perhaps get this out first to people who are using this end-of-life hospice. And then better yet, it seems from what you're sharing, that you see this model of healing being used, and we could call it palliative care instead, in many, many individuals who don't need emergency interventions, even while they're recuperating.
Yes. You know, we're thinking about any chapter in our lives to be more dignified, more comfortable, more fulfilling, and how I respect and honor, and all nurses and social workers and teams respect people's differences and their religions and where they're coming from. And I think that's why I've studied so many different treatment modalities, because I wanted to understand all faiths. You know, some people don't like the word Reiki. They come from a background that they don't understand the symbols and what that is. So I studied laying on of hands from the Christian perspective. And I've just kept studying and studying and studying. And it's really helpful when the team understands someone's faith. And if we don't understand, if it's something new to us, we actually discuss it and talk about what are their rites and rituals? How is their family feeling? What do they need to do at end of life? Do they have any customs? And people start to really think about that in a way that they hadn't before. So in this book, I think people may even be able to think about that earlier on, like you say, in palliative care, and what that looks like anytime we're not feeling well, or even when we're feeling well.
Or even when we're feeling well, which takes it out of that hospice end of life thing. So this is a question that often would come up with nurses who are dealing with the death, really. You're dealing with death if you're really a hospice care person. Does that get depressing for you, kind of knowing that whoever you cared for today, you come in the next day and, that bed's gone, you know? How does that feel from a professional level?
I think that's a very good question, Ellen, because I get asked that a lot by families when I'm there pronouncing patients who have died. And they're like, how do you do this all the time? And we in hospice and as holistic nurses, we see the love of families. I see them around the bedside. And sometimes I even see family members that have been estranged that show up. And I get so pleased with that, this reconciliation. I've had people come around the bedside and they hold hands, and I may lead them and prompt them a little bit, but sometimes they tell me that they've actually never held hands as a family. I get so proud to see it's like a birth. It might be sad and painful, but it's so beautiful at the end to give someone a peaceful death. And also we in hospice, and I have a new CEO, Mary Crosby, at my hospice. She's young and she believes in parties and getting us together. So we also need a perspective outside of work. We need to get together with people who are doing this all the time and just have fun. So we hire a team of figuring out how to have fun and how to have the time to have fun. So I'm fortunate.
Well, I would like you to just make perhaps a reference right now, since we're still in a COVID pandemic. How is that affecting things in hospice? Because I know there are times if the patient has COVID, the family cannot even visit them, and you have to, be all masked up, and there's much less human touch.
This has been, as for all medical providers, a very hard couple of years, as we know. And in hospice, we have been impacted quite a bit. Our numbers are through the roof of caring for patients. And even right now with this Omicron virus, people are going into the hospital, an 85-year-old woman going into a hospital, maybe with congestive heart failure, and their family members are not allowed to go. And I cannot believe we are going back to early 2020. So people are reaching out to hospice maybe a little bit sooner. Maybe they could have been treated in the hospital for congestive heart failure, but they're so afraid to die alone, they choose to come on hospice early. So that's a rise in hospice, which is nice, but not necessarily the way we want it to be. It's been a forced hospice.
So you're saying in hospice, they're still allowing family visitations, even if the patient has COVID?
Well, yes, but so understand one of the things is we see a lot of patients in their private homes. So most hospice is wherever the family member is. So we see home care and take care of families in their home. So if the patient has COVID, it doesn't matter. The family wants to be with them. And we have hospice centers where we don't care if the patient has has anything. We don't care. We take care of the patient. Any diagnosis doesn't mean anything to us, just like in the AIDS epidemic. Gosh, that was crazy. People were afraid to take care of people. And we are just holistic and caring and loving. So hospice takes place either in a skilled nursing facility or at home or in hospice centers.
Okay, well, we're going to end there, Aimee, because we've come to the end of our time together. But I want to thank you, listeners, for listening to Herbally Yours on the Voice of Nassau Community College. And thank you so much, Nurse Aimee Whalen.
Thank you, Ellen.
For further information, you can email us at whpc@ncc.edu. This is your host, Ellen Kamhi at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.